How does neuroimaging help understand social cognition deficits in schizophrenia? Have you ever wondered how scientists study the brain to understand conditions like schizophrenia? One powerful tool they use is neuroimaging. This technology helps researchers see what happens in the brain, especially when it comes to social cognition deficits in schizophrenia. Social cognition is all about how we perceive, interpret, and respond to social information. This includes recognizing emotions, understanding what others are thinking, and showing empathy. Unfortunately, these skills can be impaired in individuals with schizophrenia, making social interactions challenging. Neuroimaging techniques, particularly magnetic resonance imaging and functional magnetic resonance imaging, allow scientists to look at both the structure and function of the brain. Structural neuroimaging has shown that people with schizophrenia often have reduced gray matter volume in key areas of the brain that are important for social cognition. These areas include the frontotemporal and limbic regions, such as the superior and middle temporal gyri, temporoparietal junction, medial frontal cortex, and orbitofrontal cortex. When these areas are affected, it can lead to difficulties in recognizing facial emotions and understanding others' mental states. On the functional side, neuroimaging studies reveal how the brain activates during social tasks. For example, when individuals with schizophrenia participate in tasks that involve social interaction, functional magnetic resonance imaging shows abnormal activation patterns in the social neural network. This means that their brains process social information differently compared to those without the condition. These functional changes can contribute to the social cognition deficits that many individuals with schizophrenia experience. Interestingly, research indicates that these brain abnormalities and social cognitive impairments are stable traits of schizophrenia. They are often present early in the illness and can persist over time. This suggests that they are not just side effects of medication but may have a genetic or neurodevelopmental basis. In fact, even unaffected relatives of individuals with schizophrenia can show milder signs of these brain changes. By pinpointing specific brain regions and networks involved in social cognition deficits, neuroimaging helps clarify the underlying mechanisms of schizophrenia. This knowledge is essential for developing targeted interventions, such as cognitive remediation therapies and social skills training, which aim to improve social functioning. Additionally, neuroimaging biomarkers can assist in early diagnosis and tracking treatment responses related to social cognitive abilities. In summary, neuroimaging provides a detailed view of the structural and functional brain changes associated with social cognition deficits in schizophrenia. It reveals how alterations in key brain areas disrupt the processing of social information, leading to the social challenges faced by individuals with schizophrenia. Understanding these connections is vital for advancing research and clinical approaches to address these core issues.